Good morning, everybody. Thank you so much for joining today's Using PSYCKES for Crisis Work webinar. My name is Michelle Hand, and I'll be leading today's presentation. I'm on the Medical Informatics team from the Office of Population Health and Evaluation. So let's go ahead and get started. Just a couple of housekeeping rules so far. We have all of the phone lines muted to help prevent any background noise, but you can still ask your questions during today's webinar. And to ask your questions, you'd want to use the Q&A box, and you can locate that by navigating to the lower right-hand corner of your screen and clicking on the 3 horizontal dots you see, and then the Q&A option should be on that list. And you can type questions to all panelists, which should be the default. Please don't use the chat function, as we'll just be monitoring Q&A today. And then just a note that all the slides and recording links will be sent to all attendees after the webinar. And here's our agenda for today. So we'll do a brief PSYCKES overview about what PSYCKES is, who's included, what data is available in PSYCKES. Then we'll go over access to client-level data. And since this is a crisis-related webinar, I wanted to show you how to enable a clinical emergency level of access to a clinical summary. And then we'll go into recipient search and look at some crisis-related filters you can find there. We have MyQR report today, so we'll look at some crisis-related and hospital-related measures and filters. And then we'll go into the clinical summary to review some crisis-related client-level details you can find, if applicable to the client, in the clinical summary. And then we'll actually have a live demo today of the PSYCKES mobile app. So I'll go into the iPad in real time, and you can watch me sign the e-sign consent form. If you're out in the field and you need to have somebody sign the consent form and they give consent, we have a new e-signature option available in the mobile app. And then we'll finish off with any training and technical assistance needs. So we'll start with our PSYCKES overview. And what is PSYCKES? So PSYCKES is a secure HIPAA-compliant web-based application used for sharing Medicaid claims and encounter data. And it's really designed to help support data-driven clinical decision-making, care coordination, and quality improvement. We do have ongoing data updates, so our clinical summary, that client-level detail, is updated on a weekly basis, and then our quality indicator reports are updated on a monthly basis. And who is viewable in PSYCKES? So right now we have, I believe, over 11 million New York State Medicaid enrollees in our application, either currently enrolled in Medicaid or previously enrolled. And this includes folks that are fee-for-service, those that have managed care, encounter data, and we also have dual eligible folks in PSYCKES. But I want to note that we have Medicaid data only at this time. So if, for example, someone is dual eligible and their medications are paid for by Medicare, those would not show up in the application. You would only see Medicaid information at this time for those dual eligible folks. And then along with being a Medicaid enrollee, either currently or in the past, somebody also has to be in the Medicaid behavioral health population to be included in PSYCKES. So they would need at least one of the following: billed to Medicaid, a psychiatric or substance use service, a psychiatric or substance use diagnosis, or any psychotropic medication billed to Medicaid. But once someone is in PSYCKES, you'll see data for them across the treatment spectrum. So that includes things like living in residential, general medical, behavioral health-related information, care coordination, etc. So here's our long list of data information that we have coming into PSYCKES. So we have that clinical summary, that client-level detail, and that provides up to 5 years' worth of data. And again, that's updated on a weekly basis. And then we have Medicaid billing data across treatment settings. So this is Medicaid billing for medications, medical and behavioral health, outpatient or inpatient services, ER, crisis hospital services, health home, care coordination, housing and residential, lab, radiology, and more. But besides our Medicaid billing data source, we also have other state administrative databases pulling into PSYCKES. And these are considered more real-time since the lag here is shorter. It's 0 to 7 days for these state administrative databases. So one of our newer databases that we have in PSYCKES is the New York City Department of Homeless Services, our NYC DHS data. So this information contains somebody's shelter name, the program type, their placement date or exit reason, and even their shelter director contact information. We also have health, home, and care management information coming from MAP. So you can see actually somebody's health home contact information, and that's pulled in through the DOH website for somebody who's enrolled in a health home. And then we have managed care plan and HARP status coming from the managed care enrollment table. We have the managed care plan assigned primary physician, and we're getting that quarterly from the Department of Health. We have AOT, assisted outpatient treatment provider contact information, coming from TACT. We have ACT, so assertive community treatment provider information, that's coming from CARES. And CARES is also sending us adult housing and residential information as well. We also have intensive mobile treatment, and this is for clients currently or previously enrolled in IMT. So it'll include things like their enrollment date, their discharge date, their team name and team contact information. That would be displayed in their clinical summary current care coordination section. And we're getting IMT data from the New York City Department of Health and Mental Hygiene. And then we have AOT referral under investigation data coming to us. We have state PC data, state PC EMR data as well. So if somebody spends some time in a state PC and their state PC doesn't bill Medicaid directly, we still get that information because we have the state PC EMR as a data source. We have suicide attempt information coming from NIMERS, and this is one of the instances that's not restricted to that 5-year look-back rule. So suicide attempt information is all available data, meaning if an attempt occurred 10 years ago, it would still show up in PSYCKES for that person. And then we have safety plan screenings and assessments, and those are entered in by providers in My Choice. So we have quality indicators, also known as quality flags, and these are flags are something that OMH has identified using a number of health conditions or treatment issues that are important enough that they're worth scrutinizing. So what PSYCKES does is it tracks clients who are positive for one or more of these health conditions or treatment issues. So that way the provider or the mobile crisis team or the managed care plan or government leadership, they can be made aware and take the necessary next steps. And these flags can also assist in supporting clinical review and quality improvement. So we have a number of flags in our application. They're sorted by indicator sets or buckets. And here's just some examples that we have. So we have the high utilization indicator set, and this looks at clients who have had multiple hospitalizations in the past 13 months. So here's just a couple of examples of the high utilization flags. We have 10 or more ER visits for mental health, or 4 or more inpatient or ER visits for mental health. We also have medication-related flags, such as someone who was diagnosed with major depression and started on an antidepressant, but didn't remain on that antidepressant for a minimum of 12 weeks. Or you can look at somebody who has 4 or more psychotropics. And then we have acute care utilization related flags, and an example of this would be someone who has had 2 or more ER visits related to behavioral health, or we have a bucket of readmission flags for people that might be cycling in and out of hospitals. And then lastly, we have the mental health performance tracking measure set, and this set is a little bit different. It's run by the Department of Health, and it has a 6-month data maturation period. But these flags, an example of one of these flags would be no follow-up after mental health ED visit or mental health inpatient visit within 7 days or 30 days. And if you ever have any questions about why an individual is flagged for a specific flag, we have most of the quality indicator text specs on our website, on our quality indicators page, except for the DOH-run measures, such as that mental health performance tracking measure set. But I would recommend reviewing our technical specifications first, and if you're still unsure or have any questions, you can always feel free to contact our PSYCKES help desk. All right, so what types of reports are available in PSYCKES? We have those client-level reports I've been mentioning, which is the clinical summary. And again, that includes Medicaid and state PC treatment history for up to 5 years. We also have some provider agency-level reports. So recipient search is a popular page that we have, and that's where you can run ad hoc reports to help identify any cohorts of interest. So today, again, we'll be looking at those crisis-related filters, but there's a lot of different options on the recipient search screen. And if you're interested in learning more about recipient search, we have a webinar dedicated just to this page called Navigating Recipient Search for Population Health. That might be helpful to you. And we have MyQI report, so we'll look at that today as well. And that will show current performance on all quality indicators, and you can drill down to client-level views. We have our usage reports, and that shows PHI, protected health information accessed by staff. We have our utilization reports, which helps to support value-based payment data needs. And then we have our statewide reports, and here you can select a quality indicator and review those proportions by region, county, plan, network, or provider. All right, so I'm going to go into accessing client-level data. So clients are assigned to a provider agency or hospital in one of two ways. They're assigned either automatically, meaning that the client has had a billed service at that provider within the past 9 months, or the client is enrolled in that facility's health home or care management program according to DOH MAP. The other way a client can be linked to your view in PSYCKES is if they were manually attached to your agency. And this can be done via signed consent, so the signed PSYCKES consent, the signed BHCC consent, or the signed DOH health home consent. It can also be done via verbal PSYCKES consent as well. And then another manual option is that clinical emergency, which I'll show today, and that gives you access to a client's clinical summary, all available data for 72 hours. And then the last manual option would be attesting that the client is being served by or transferred to your agency prior to billing coming through or prior to you obtaining signed consent from that client. Now, without signed consent, there are a few things that might be missing, or you might not be able to access a person's clinical summary. So PSYCKES allows access to protected health information without signed consent only for individuals that have an applicable quality flag and have had at least one billed service at your agency within the last 9 months. However, if you are able to drill in with those criteria, there could be information missing from that person's clinical summary, which is called our specially protected data. And that includes substance use information, HIV, genetic testing, or family planning information. So if you're able to drill into somebody's clinical summary because they have an applicable quality flag and because you've served them in the past 9 months, there still could be some information missing because you don't have consent or clinical emergency access. Now here's the difference. With signed consent, you have expanded access. So this includes new clients who haven't been linked to your agency through Medicaid billing. You would be able to view them through signed consent or clinical emergency access. You can view clients that don't have an applicable quality flag. And again, you can, with signed consent or clinical emergency access, you can view all available data, including that data with special protections, which again is substance use, HIV, genetic testing, or family planning. Now, when you do get consent, with signed consent, you are able to view that person's clinical summary for up to 3 years after their last billed service. or if they choose to withdraw consent, whichever comes first. With verbal consent, you would be able to access that person's clinical summary for 9 months. And then the last option is in clinical emergencies, you have that limited duration to the clinical summary, and that's for 72 hours. After the 72 hours is up, you would need to obtain consent to view that person's clinical summary with all available data. So here's the definition of what constitutes a clinical emergency. So we use this definition from the New York State Public Health Law as guidance. Now, there are just a couple of key parts to highlight in this passage, and the first is that a clinical emergency would be an emergency condition, and it's a medical or behavioral health condition in which the onset is sudden, so there is that immediate need. And the symptoms are of sufficient severity that the absence of immediate medical attention would result in serious consequences, namely harm to selves or others. So when using the clinical emergent option to access data in PSYCKES, it's best to document that emergency in the client's chart. And here's a helpful visual comparison chart of the ways to access data in PSYCKES. So the leftmost column shows the type of ways that data can be linked to your agency, again, either automatically or manually. And then the second column shows the level of client access. The third column shows whether or not the client has a quality flag. And then the fourth column would show whether any data at all will be displayed with each type of access. The fifth column would show whether or not data with special protections would be viewable. And then that last column all the way to the right would show the amount of time that the data is available. So again, these slides will be sent out to everybody so you can reference this in the future if needed. So there are two ways to enable access to client-level data within PSYCKES. You can use recipient search, which is that screenshot at the top, or you can use the Manage PHI Access submenu, which is located in the Registrar tab. So to enable PHI access, first we'll use recipient search as an example. So first you'd search for that client using one or more of their unique identifiers. So that means their Medicaid ID, their Social Security number, or their first name, last name, or date of birth. After searching for the client, you'll be brought to the results page, and here's where you can confirm that the client listed is a correct match. And you can also view their current PHI access level here. So if you look to the far right, the current PHI access column currently says no access. So we're not able to drill into this person's clinical summary because maybe we haven't served them in the past 9 months, or maybe we have served them in the past 9 months, but they don't have any applicable quality flags showing. So next you would click Enable Access on the far right, and the PHI Access module box will appear. So the first step is to attest why you're allowed to view this data. So for crisis workers, you might be using the clinical emergency access level here, which grants you access to that client's clinical summary, including the data with special protections, for 72 hours. So I'm going to select this as a clinical emergency and click Next. And then you'll have to answer how you know this is the correct person. So here you can select that the provider attests to the client's identity, or the client provided one form of photo ID or 2 forms of non-photo ID. So in this example, we chose that the client provided one photo ID, and that was the U.S. driver's license. And next you can click Enable, or Enable and View Clinical Summary. Enable will bring you back to recipient search, and Enable and View Clinical Summary will bring you right into that person's clinical summary. And then there's just that note on the bottom that says Main Street Clinic will be given access to all available data for 72 hours. So after enabling emergency access for this client, this is what it'll look like when you search for that client again you will see in the current PHI access column, it will display all data emergency. So that means that that client has clinical emergency access. And once those 72 hours are up, it'll revert back to no access. All right, so I know I went over a lot so far, so I wanted to take a quick pause here and check in with Dee Dee if we had any questions come in.
Hi, Michelle. There's no questions to be answered on air at the moment.
Okay, great. Thank you, Dee Dee.
Of course.
All right, so we'll move right on to recipient search. All right, so we have a couple of different options in recipient search. We have individual client level, we have the individual search, where you can look up one person to view their clinical summary, or you can do the group search. And here you can slice and dice your report and add on different filter options that you'd like to view. Some examples that we've included here is, one of them is our newer social determinants of health filter box in recipient search. And here you can look at a specific social determinant of health domain or a condition. And I'll show what that looks like. We also have an alerts filter box, so here you can search for clients that have had suicide attempts, opioid overdoses if you have consent or emergency access for that client, suicide ideation, etc. And then we also have a homelessness filter box. So here you can search for anyone experiencing homelessness in the past year, if they're unsheltered, if they're in outreach, and I'll show what that looks like. And then we have crisis service utilization filters, and you can also search for high utilizers in recipient search. And then I wanted to note here, we also have advanced views. So here you can really focus your search on a specific category. So we have care coordination, high need, high risk, hospital utilization, and outpatient providers. And I'll show what one of those looks like in a few slides. So this is what the recipient search screen looks like. So we went up to the purple navigation bar at the top, selected recipient search, and this is the page you'll land on. So here at the top, we've highlighted where you can perform that individual search for one specific client. And we recommend using their Medicaid ID or Social Security number as a unique identifier because it typically returns one result on the page, whereas the name could return more than one result. And below the recipient identifier section, we have the group search section. And this is just a portion of the recipient search page. There's a lot beneath this. So here you can really slice and dice that report to look up cohorts of interest. All right, so I'll show what the newer social determinants of health section looks like. So this section includes societal and environmental conditions that can impact a wide range of health risks and outcomes. And here we use Z codes and Medicaid billing as a data source for this section. Now when you run a search using the SDOH section, you'll have the ability to select a domain category. And in this screenshot, the domain category is problems related to housing and economic circumstances. Or you can expand this domain category using this little plus sign, and you can see all of the social determinant of health conditions within that domain. And you can select up to 4 different filters in this section when running a search. So here's just an example. If I selected within that domain I was just showing, I selected transportation insecurity, extreme poverty, and lack of adequate food. And then next we'll move down to our special population section. So here's where you can find the alerts filter dropdown. And this has a few different options here. You can search for suicide attempt information, suicidal ideations, self-harm, self-inflicted poisoning. We have these overdose options, but again, I want to mention that to see any substance use related data, you would need consent, signed consent, or clinical emergency access. And then we have overdose risk, concurrent opioid and benzodiazepine for anyone that's on both of those medications. anyone that's been placed on one of our registries, and OMH unsuccessful discharge. And then we also have those homelessness alerts I was mentioning. So here, up to 4 homelessness options can be selected in each search. And that will create an OR logic because you're searching within the same filter box. So in this example, we're searching for anyone that's been in a shelter, according to DHS, or outreach, or a behavioral health shelter in the past 1 year, or they've been unsheltered in the past 1 year. And then we can go on to our quality flag filter box. And here I've just highlighted a few different hospital-related or high utilizer quality flags that we have. So we have 10 or more ER all cause. So this is individuals with 10 or more ER visits for medical or behavioral health cause in the past 13 months. And below that, you can see the rest of our high utilization indicators. Some of these indicators that aren't included in my QI report are the 4 or more inpatient ER behavioral health or the 4 or more inpatient or ER medical quality indicators. So those are something you can use within recipient search. And again, you can select up to 4 quality measures here. And then we have some crisis service settings in recipient search that you can search for. So right now we're in the services by any provider section. You can see right at the top left of the screen. And this will show you clients that you're serving that are receiving other services from any provider in New York State. So in this example, I've expanded that crisis service category by clicking on that little plus sign. And here you can select up to 4 service settings in each search. So we have CPEP Mobile Crisis, CSIDD, which stands for Crisis Services for Intellectually and Developmentally Disabled. We have Crisis Intervention Service filters, Crisis Residential filters, or you can select at the bottom Crisis Service Any, which would capture folks receiving any of these crisis services from any provider in New York State. And the default look back for this section on the top right is the past 1 year, but you can change that to another time frame if you'd like. Another thing I wanted to mention about this section is here you can also search for those high utilizers at your agency. So we're still in that services by any provider section, and there's a service utilization filter. And here you can select a certain service type, such as clinic MH all, ER services, or inpatient services. So once I select one of those service utilization options, I selected ER, BH, diagnosis, service, or CPEP. The number of visits drop-down works in conjunction with this filter drop-down. So you can search for people that have had ER, BH services more than once, more than twice, or even 20 or more times in the past year. So just to run an example search here, what I've done is I've searched I'm logged in as Main Street Clinic, and I've searched for clients that have had any alerts. And when I say alerts any below, it's referencing all of those filter options in the alerts dropdown, such as suicide attempt or ideation, etc. So I've searched for people at Main Street Clinic that I've served that have had any alerts and have had CPEP mobile crisis services at any provider in New York State. So on the results page, I have 125 recipients that match this criteria. And here I can see their name. For this training, everything's been de-identified, but you would see the client's name here, their Medicaid ID, their date of birth and gender, any Medicaid quality flags that they meet criteria for, their managed care plan, and then the current PHI access level that I have to their clinical summary. So for some of these folks, I have quality flag level of access, which means I don't get that specially protected data like substance use. For this person, I have no access. And then at the bottom, you can see for this person, we've had them sign the PSYCKES consent form. So I'm able to access all available data, and I'm able to see that they have some substance-related quality flags. And you can also change to an advanced view on the recipient search results page, and I'll show what that looks like in the next slide. And then you can export this results page to PDF or Excel. So if I have selected the high need, high risk advanced view, you can see that on my results page there's been additional columns added and a scroll bar now appears at the bottom. So I've added to my results page a few different columns, and I'll just read them off. We have OMH unsuccessful discharge, TAY transition age youth. We also have OPWDD New York start. And then if we scroll to the right a little bit more, we can see if any of these clients are Health Home Plus eligible, if they have AOT or when their AOT expires, if they have suicide risk, so suicide attempt in the past year, any suicide ideations, self-inflicted harm or injury, or self-inflicted poisoning. And then if I scroll a bit further to the end of the page, I also have added on the overdose risk columns and the PSYCKES registry columns if they've been added to one of our registries. And you can export this to Excel as well. So I'm going to take another quick pause here and just see if there are any questions about recipient search that came in.
Hi, Michelle. No questions at this time.
Okay, thank you, Dee Dee. So I'll move right into my QI report. So my QI report is used as a tool for managing quality improvement efforts, and again, it's updated on a monthly basis. And in my QI report, we display the eligible population, which is also known as the denominator. And this is the number of clients served by your organization in the past 9 months, plus any other parameters depending on that specific quality indicator's specifications. So this is just an important note I want to make quickly, that each of our quality flags have their own set of technical specifications, and I mentioned this a bit earlier, but it's really important to refer to those just to see if there's any other parameters for who's included in the eligible population or what this flag's looking at. And then we have the number with QI flag, and that's the numerator. So that's clients that meet criteria for that specific flag. And then that's converted into a prevalence rate. So that's just that numerator, the number with QI flag, over the denominator, which is the eligible population. And in my QI report, you can compare your prevalence rate to the region and statewide prevalence rates as well. And in PSYCKES, you'd want to see that prevalence rate go down over time, which might be different from some applications, some other applications. But the lower the prevalence rate in PSYCKES, the better you're doing. So a high prevalence rate indicates that there's some opportunity for improvement. And then you can also filter my QI report by program type, and for example, you can filter it by crisis services, managed care plan, or age, county, etc. And then, as of with all of our reports, you can export to Excel or PDF. So before we look at some screenshots, I just wanted to make sure that we understand my QI report itself. And one of the things we want to make sure folks are understanding is how clients are being attributed to your agency in my QI report. So clients can be attributed to my QI report through billing. So clients that have been linked to your provider agency if they've been billed by your agency within the past 9 months. And this rule is just used to automatically link clients to providers so that the most current clients are included in the report for each month. Now we have a period of observation for quality indicators, and this is assessed by a measure, and that it varies for each measure. So for an example here, we're looking at the high utilization quality indicator set, and the period of observation for this indicator set specifically is the past 13 months. So from the as of date in my QI report, we're looking back 13 months from that as of date. And then we also have QI reports trending over time, which is called QI trends past year, and that just shows the prevalence rates of quality flags by provider over time. So I'll show what this looks like. Here you can see we're on My QI report. On the top left, we've gone into the purple navigation bar and clicked on My QI report. And you can see that when we're looking at My QI report, your agency's name will appear at the top, and directly underneath that is the quality indicator overview as of date. And in this screenshot, it's as of 7/1/2023. Now below that, My QI report is divided into two categories of indicator sets to help identify between more real-time measures versus more mature measures. The quality improvement indicators, which is located at the top of this section, the quality improvement indicator section, these are considered more real-time and are run on a monthly basis as of the refresh date. Now the performance tracking indicators below, those are set more on mature data and are calculated monthly after a 6-month data maturation period, and that just is to allow for services to be invoiced. So I already went over what each column means, but just to quickly review, we have the indicator set name, the population within that indicator set, the eligible population, meaning the denominator that we talked about earlier, and then we have the numerator, so that's the people that are meeting criteria for flags within these indicator sets, and then that's broken into or divided into a percentage, and then you can compare that to the regional percentage or the statewide percentage. And there's a little helpful bar graph on the far right to show you visually how you're doing compared. And another thing we can do that I mentioned within My QI report is filter our report. So we'll go ahead and click on that blue filter box. And here you can see the filter box pop up. And in this example, my agency has some crisis services I can choose from. So I can select either CFTSS, crisis intervention, or a specific crisis intervention service program type, or lastly, crisis service any, which would include any of these 3 crisis services above it. So if I click on crisis service any, for example, and apply that, then you can see the numbers on My QI report screen have changed because I've applied that program type filter. So what I'm going to do next is drill into the high utilization inpatient ER indicator set. And this will open up the list of different indicators that live within that high utilization indicator set. So let's say I'm interested in seeing who of my clients that received any of those crisis services at my agency are flagged for 2 or more inpatient behavioral health stays in the past 13 months. We can see that we have 26 people that meet criteria for this flag that received any of those crisis program types. And again, here's where we can compare our prevalence rates for this particular indicator against the regional and the statewide prevalence rates. So we can see that we're a bit higher than both the regional and state. So if I drill into that specific indicator, you can now see the recipients list in My QI report. So again, we have de-identify on, but this would be a list of clients' names, their Medicaid ID and date of birth, their race or ethnicity, their quality flags that they meet criteria for, their most recent behavioral health outpatient attending, and then the date the clinical summary was last viewed. So you can drill into a clinical summary here, or you can export to PDF or Excel on the top right. Okay, so I'm going to go into the clinical summary now. It's a lot of information to cover, so I'll try my best to cover it all. But the clinical summary in PSYCKES, again, is that client-level detail, and it provides up to 5 years' worth of treatment history. And it really provides an integrated view from all databases available in PSYCKES. So we have, for example, homelessness information, those social determinants of health, high mental health need of reason, if they have that flag, any active quality flags they meet criteria for, care coordination information, the IVOS graph, Integrated View of Services, which I'll show, AOT status, hospitalizations or crisis services, alerts, including suicide risk and attempts, etc. So I'm going to go into the next slide now. And here I'm just explaining the different types of viewing options you have in the clinical summary. So you have the brief overview, which is the default screen that you'll see, which is a quick snapshot of the client's data, or you can drill into the 1-year view or the 5-year view. And here's what the clinical summary looks like. Here's the brief overview page. So again, here we can see a snapshot of the most critical information. We can see their general information at the top, such as their name. And right underneath their name, you can see the clinical summary as of date. And in this screenshot, it's as of 7/30/2023. It's updated on a weekly basis. You can also look more into the data sources included in the clinical summary by clicking on that data sources link. You could export to PDF if you'd like. But here we have the current care coordination section. So in this example, we have this homelessness information coming in for this person through NYC DHS data. We have Health Home Plus eligibility, so it'll show you why this person's eligible for Health Home Plus. We have high mental health need. So they met criteria for the high mental health need flag, and this is where you can see why they've met criteria from these events. We have the alert section in the brief overview. So here I can see that they've had 10 homelessness stays at a DHS shelter. They have had suicide ideation, and then again they've had homelessness, this time reported in Medicaid billing. And again, this is all available data, meaning it's not restricted to this 5-year look-back rule. We have social determinants of health showing here as well. And if you scroll down on the brief overview, we have a few other sections: diagnoses, medications, outpatient providers in the past year. But the section I want to mention is the all hospital and crisis utilization section. And in the brief overview, this actually looks back the past 5 years instead of the past year like some other sections. We have a specific part of this dedicated to crisis services. If somebody has had crisis services in the past 5 years, it would show here with the number of providers, what type of crisis services, and then the last crisis service that they had and where. All right, and then I'm going to go through this a bit more quickly to get to my live demo, but the current care coordination section we've already gone over a bit, and same with the alert section. So this is just here if you need it in the future, if you need to review the slides about what could be included in these sections. And then we're going to drill into that 5-year clinical summary view. So you can tell there's a bit more space on the page now and a bit more information showing. So here's that homeless service data that came in for this person, the care coordination alert for Health Home Plus eligibility, and that high mental health need message is still showing there. But something I want to mention is in the alert section. Here you can see the different alerts over the past, or all available data, not limited to the past 5 years. But you can see information on the alert type, the number of events, meds, or positive screens. You can see their first date for that alert and then their most recent date, the provider name and the program name, and then the severity, diagnosis, meds, or results in this column if applicable. Same with the social determinants of health. There's a bit more information if you want to click. You can actually click on the social determinant of health in the 1- and 5-year views and see more information about the date of service, service type and subtype, and any related diagnoses. And then this is our integrated view of services over time, the IVOS graph. So here we're in the 5-year view, so we're looking back the past 5 years. And this really helps you to see patterns in service history and utilization. So here we can see that this person has had a history of crisis services, which are highlighted such as crisis residential, CPEP mobile crisis, and they've also experienced homelessness. So here you can hover over specific dots or lines to view the provider and date associated with that point in time. Or you can go to the top right of this section and toggle to a table view if you prefer that. And then our hospital ER crisis section is the last section I wanted to show from the clinical summary. And here you can see that we have the service type, which a few of them are including some crisis services that this person has had. You can see the provider for that service, the admission and discharge date, their length of stay and most recent primary diagnosis, and any procedures that they had during the visit. And similar to the IVOS section, you can also toggle to a graph view here to view more service history. Okay, so what I'm going to do now is go into the live demo, and I wanted to also take a quick pause here for questions in case anything came in.
Nothing new yet, Michelle.
Okay, thank you, Dee Dee.
Of course.
Okay, so let me go to share my screen here. I'm going to stop sharing here. Let me see if this will work. Okay, let me try a different way to share. Sorry, it's taking a bit longer than expected. Try this one. There we go. Okay, so I'm going to open up my PSYCKES application on the iPad. And what I'm doing right now is I'm logging in. So I put in my user ID, and then I entered my passcode, and now I'm logging into the iPad mobile app. All right, and I'm going to agree to the confidentiality. And now what I'm going to do is I'm going to search for a sample client, but let me make sure I have de-identify on first. So to put de-identify on in the mobile app, you can go to the settings on the bottom right and then toggle to de-identify on. So here I'm going to enter in a Medicaid ID. And I'm going to search for that person. And this is all scrambled because of de-identify, but first I'd make sure I've found the correct person I'm looking for, matching their name and date of birth and Medicaid ID, and then I'll click on their profile. So this person already has PSYCKES consent, but let me actually go back and search up somebody else that doesn't have consent. So 1 second. Okay, let me do somebody else. Okay. Must have forgotten to take that off. Okay, so reviewing that this person is the correct person. And here I don't have any type of consent for this individual. So I'm going to click Enable PHI Access. And here you can see the different options we have. So in the mobile app specifically, we have the option for e-signing the PSYCKES consent form. So if you're out in the field and you have your iPad or your iPhone with you, you can select this option to e-sign the PSYCKES consent. So there's the other normal consent options I went over earlier. So I'm going to select e-sign PSYCKES consent. And here's the overview for the e-signature. You'll want to confirm that client's identity, review the consent form with the client. The client will then choose to give or deny consent, and if the consent is given, then the client will sign the consent form on the screen. So here I'm going to click Next. How do I know this is the correct person? I'm going to say they presented one photo ID and click Next. And then here you can select what photo ID they've given you. So I'm going to say the driver's license and click Next. And this is where you'd have the client review the consent form. Or you'd go through it with them to make sure they understand what they're potentially signing. So I'll click Next after reviewing this with the client. And this is where the client can decide to give consent or not give consent. So I'm going to select I give consent for the purpose of this training. And then it says who's signing. So the first option is going to be the client's name, which is scrambled for the training, or a legal representative might be signing in case this person's in a crisis. So I'm going to select that I, myself, the client, I am signing, and then you can give them the iPad and they can just draw their signature on the iPad itself, and then you can click Next. And then it says confirm to save the signed PSYCKES consent form. So I'm going to confirm to save this into this person's clinical summary. It would show up in their plans and documents section if they ever wanted to get a copy of it. Okay, and then it says you're all set, so I'm going to click View Clinical Summary. I'll let that load. All right, so now I have complete access to this person's clinical summary, including that data with special protections. So just to give a brief overview of our mobile app, we landed on the overview page, and this is iPad specific. So the overview is only included in the iPad, not the iPhone. So I want to show what this looks like because it's pretty cool. This is the overview, the same thing you'd see on the web. And you can scroll down and see their current care coordination information section. You're able to click on phone numbers and call directly using the clickable phone number. We have the alerts section here, the quality flags, diagnoses in the past year, their medications in the past year, outpatient providers, and here's the hospital and crisis utilization services. So this person hasn't had any crisis services in the past 5 years, but if they did, they would show up there. And to look at the 1-year view, I'm going to click on the alerts section on the left-hand navigation side. And here I can see more information about their alerts. So I can see the date, the alert and program type, the provider, and the diagnosis, the primary diagnosis and results. So a lot of these alerts are for suicide ideation, I can see pretty recently this year. So this might be a client I want to work with a lot just to help through these alerts that they're getting. And then if you go to services over time, this is the next section I want to show. This is the IVOS graph, but in the iPad, which is pretty cool. So here you get the same IVOS graph that you'd get in the web. This is looking at the past year, but you can actually take your fingers and zoom in on specific dates and time and click on specific dates and time to see the provider and that date that you're looking at. The last thing I want to show is the hospital ER crisis services section. So here we have a card at the top showing a summary of the service types and the number of visits for that service type. So you can see they've had 9 ER medical visits in the past 5 years, 16 ER visits for mental health. Because I have their e-sign consent form, I'm able to see that they've had ER substance use visits and inpatient substance use visits. So here there's just a chronological list of these services, but if this list, sometimes can get pretty lengthy, so if you want to filter for a specific service type, you can use that filter box. Let me show you. It's on the top right of the page, so I'm going to click filter, and now I can select a specific service type that I'm interested in. So maybe I'm interested in ER mental health since they've had 16 in the past 5 years, I can click Apply, and now I'm only seeing those ER mental health service types and the information associated with those. So those were the main things I wanted to show on the iPad. I'm very happy it loaded for me to show this. So I'm going to go back to my other screen just to finish with some technical assistance and training webinars. We have, I'll stop sharing there. And let me share my other screen. Okay, so just for reference, I did include some screenshots of the mobile app e-sign consent feature. I already went through those. So just for reference in the future, I also included some screenshots of those iPad features I was just showing. So with 5 minutes left, I'll just go over some training and technical assistance, and then I'll stop for any final questions. So we have the training webinars available on our PSYCKES webpage. So on our PSYCKES training webinars section, we have live webinars like today, and you can register for those. Or we have recorded webinars. So for example, this recording link will be put onto the website shortly, and you'll be able to reference it in the future if you're not able to make the live webinars. But we have a bunch of different webinar options. We have Introduction to PSYCKES to give you an overview of all of the tabs in PSYCKES. Where to start if your agency is looking to get access to PSYCKES, that's a helpful webinar to attend or listen to. We have a Quality Indicator Report webinar, a recipient search webinar that I mentioned earlier. We have Using the PSYCKES Clinical Summary, which goes into a lot more detail about all of the sections in the clinical summary than I went over today. So that's a helpful one as well. We have Consent Emergency Quality Flag, PSYCKES Levels of Access. I talked a bit about that today, but that goes more in depth. And then our mobile app for iPhones and iPads talks about all things mobile app related, how to enter a safety plan or a screening or assessment in the mobile app, which are helpful tools in the field. And then I'm going to just talk quickly about the console. So this is a way, the self-service console is a way to manage your token and PIN, which are used for logging into secure OMH applications such as PSYCKES. And the console website is mytoken.ny.gov. And what you can do within the console website is set up security questions in case you ever forget your PIN. You can log in using those security questions and reset your PIN that way. You can also reset your PIN in the console itself without needing to go through the security questions. You can activate or request a replacement token as well. And then here's our help desk support information. So PSYCKES help is available 9 to 5 Monday through Friday at psyches-help@omh.ny.gov. And we're really here to help with all things PSYCKES related. So any questions about reports, or if you think somebody's flagged for an indicator that shouldn't be, etc., those are things we'd love to help with. There are other help desks for token and login support as well. So if you're an OMH employee, we have the fixit@its.ny.gov help desk for any token and login issues. And then if you're a non-OMH employee, you would use the healthhelp@its.ny.gov email for any login assistance. So with that being said, I wanted to check in one last time with Vidi to see if there were any questions that came in.
No questions, Michelle.
Wow, okay. Well, I really appreciate that. Thank you everyone for joining today. And again, we'll send out the slides and recording link shortly. And I hope everyone has a great rest of their day. Thank you.